This is the segment that we take each and every week and we devote to clinical conversations in and around your practice. So quite often we have special guests come in, either pre-recorded or live, and chat about items that are related to the clinical application of practice in and around your practice. Sometimes that's related directly to the care you deliver with your hands and the adjustment. Other times it's new technologies. Sometimes we look at established modalities and we look at emerging science as well. And that's where we're going today. We had our friend Dr. Alyson Evans over at Fringe. She put together a CBD course, and there is so much emerging science in this area. We're going to share a few minutes from the 1-hour course that she shared with us exclusively to give you a little taste of what they're up to at Fringe, where they're going, and maybe, plant some seeds in your mind about items you might be able to incorporate into your practice today, tomorrow, or in the future to help your patients live a better life. So without further ado, I'm going to click over. We'll watch a few minutes of a presentation all around CBD science with Dr. Alyson Evans.
Hi, everybody. My name's Alyson. I'm one of the founders of Fringe and looking forward to spending some time with you today and going through some education. So people have asked us about the name Fringe, which means a lot to all of us. The team at Fringe, we love our name. We love what it stands for. And I think when I first started looking into making a company and what mattered to me was that we would embrace the unconventional, that we would embrace people that had different beliefs and different ideas and welcome them all in and learn from them. And I think something that has been fun as Fringe has launched and people have gotten to know our brand is that I think people identify more with being on the fringe than they do in being in the center or the mainstream of something. So we have greatly appreciated everybody's feedback about our name, and really it's about being inclusive and having everybody be welcome to what we're learning, what we know, what we don't know, and being willing to have differing opinions and to honor those and learn from them. So I think the most important aspect of Fringe for all of us, if you take anyone on our team, it's that being healthy has become complicated, and that what we have done for thousands and thousands of years that we know feels good for us is within us and around us, and it is actually very powerful medicine. And we've dismissed a lot of these very simplistic aspects of health to the side, and our job at Fringe is to bring science and validity to simple aspects of medicine. And there's a reason for this. Today in 2021, we are not feeling as well as we should. As a population in the US, as a population worldwide, as myself sitting here in this chair, as my family in my home, my community, we could be feeling better. And this has definitely been a hard past couple of years. But even prior to the changes we've had as a society in 2020 and 2021, we collectively are hurting. There is a lot of people in pain. And I think it's interesting when I'm presented with statistics about 50 million Americans have some form of chronic pain. I personally can't visualize how many people that is. But I think of it this way. I think of if I encounter 10, 15 people in my day, 5 of them have chronic pain. 6 of them have chronic pain. 10 of them have chronic pain. However many people I encounter, it's trying to have empathy and sympathy for what people are going through. And so our pain statistics are not good. We are heavily medicating for pain and as well for sleep. I just read the other day that every 19 minutes, somebody dies from a prescription drug overdose every 19 minutes in the United States of America, which was a sobering statistic for me to read because I can't comprehend 15 million people, but I know what 19 minutes is, and I know what one person is, and I know the value of one life. So our sleep statistics, oh man, before COVID, 50 to 70 million adults had some form of a diagnosed sleep disorder. I'm pretty sure I have an undiagnosed sleep disorder. So I don't even know how many people actually struggle with having a restful night's sleep in which they wake up feeling recovered. And sleep is something that is also very heavily medicated in the United States and worldwide as well. When it comes to mental health, we talk a lot about anxiety, stress, depression, and I think anxiety has become something that is more prevalent over the past couple of years. It's approximately 40 million people in the United States that know that they suffer from anxiety, and I can't imagine how many people have symptoms of anxiety that they just don't actually know what it is. Racing heart, feeling, panicked, worried about the future, those sorts of things. So mental health is a huge topic, and it almost feels like we're in a shift right now where talking about mental health is going to be something that really changes the prior slides, which is talking about pain and sleep. These three topics for us at Fringe are where we're focusing our attention to try and exert the most help. They're so common for all of us. And the thing is, they are a part of us. We need to experience pain. It's how we've evolved. It's a very important signal for us. We need to sleep. And having stress in our life is something that is never going to be away. In a way, it's needed for our growth. So we are focusing our conversations around pain, sleep, and stress, and really trying to see how the aspects of medicine that we have pushed to the outside, how we can start actually making an effect on people suffering from pain, sleep, and stress, sleep problems and stress in their lives. So for us, this is an opportunity. And it gives us an area to focus on. Of course, there's many other health issues that people are facing, but I think these ones are the ones that plague people and affect them, hour by hour, minute by minute, day by day, and really affects their quality of life. So a big opportunity for us. When we look at how everybody is treated, if I have pain, I have a very isolated approach in today's healthcare model. So if I have pain, I go to the doctor runs some tests. They may send me for additional tests, blood work, maybe it might be imaging, whatever. And then I will typically go and see someone who actively focuses on fixing that pain. Most commonly, people are prescribed medication for their pain. But I think the most important thing is, if I'm suffering from pain, very few people ask how I'm sleeping, ask how I'm managing my stress, if I'm having any problems with anxiety, depression, that sort of thing. Connecting essentially the dots, they keep us in a very isolated system when it comes to looking at pains.
All right. And that is Dr. Alyson Evans over at joinfringe.com talking about some of the challenges that are endemic to what's going on with all of us today. If you'd love to see somebody on our clinical conversation segment, we're going to encourage you to reach out to us, comment down below, let us know. We're trying to bring interesting, unique points of view to our clinical conversations, which is a segment we have each and every week on the Smart Chiropractor Show, which is going on right now. Jason, what are some of your thoughts regarding Alyson's either presentation or just some of the stats that she laid out there?
I think Alyson is a great example of somebody who's taking something that is ubiquitous everywhere and presenting it in a really creative, unique way. And if nothing else, that is a great example for us to sort of learn from and model after. I don't think there's any chiropractor that would probably go, oh, CBD? That's new. Never heard of that before. But the way it's presented, the way it's packaged, from the branding to the typeface to the packaging to the style of, consumption, drinking it, wiping it on as a lotion. There are such creative ways of breaking through the noise and attracting your type of people. And what I love so much about Alyson's presentation and project is that, I always appreciated the saying, let your freak flag fly, that you will attract your type of crazy. And I'm not sure if there's any better word than referring to yourself as fringe, to let everybody in the world know that I'm okay with being different, not like everyone else. And I just love that. I love the concept of that. I love her bravery to invest her time, energy, and money in taking an idea, turning it into something, let alone turning it into something successful. I'll also comment, because these details matter, I hope, to our viewers. If they don't, they should. The quality of what Alyson put together was just phenomenal. Just the camera work, the background, everything was set in the back perfectly. Everything matters. I ask Apple Computer, Steve Jobs would say it often, these are throwaway taglines and slogans, and yet they are the details and foundations and fundamentals of what works best and what works to be the best. So I'm in awe, enamored, impressed with what she's putting together. I'll clarify for anybody who may not know me well enough to know my intentions. This is not because I think every chiropractor needs to do less chiropractic and more CBD or any other product. Nothing could be farther from the truth. I do think that we need to learn from those people that are doing super creative things, ways in which to present something normal as something different, and build a successful business and audience and following and subscription business, which is everything we're talking about this year. She's a perfect example of it, and I love what she's doing.
I could not agree more. There's so many levels to that, so much more to dive into as the weeks unfold in 2022. Clinical conversations happen each and every week on the Smart Chiropractor Show, which is what you are watching right now. Hey, if you like that video, be sure to subscribe to the Smart Chiropractor. We are posting videos on how you can market your chiropractic practice in a way that teach and invites consistently. We have found that is the magic formula to big time growth. So if you like this video, be sure to comment down below, smash that subscribe button, or visit us at thesmartchiropractor.com.